Hey guys, it's Tammy and I've just come back from a walk on this beautiful fall day in Canada, and I log in and one of the first things that pops up in my YouTube news feed is the doctors who are giving an update on Donald Trump's experience with COVID. So naturally, as a nurse, I was curious to see what was going on. And so I thought what I would do is I'm going to record myself watching the release and give you a real nurse's perspective on what the doctors are saying and are not saying. I think this will be a little bit of fun. So let's start that right after this. Welcome back. My name is Tammy and this is Nurse Minder, and on this channel we do everything nursing. So if you're new here, consider subscribing below so that you get the next video when it's released. All right, so let's get this up and we'll start to play it. It's 20 minutes long, so make sure I've got some sound here. It looks like maybe there's just a lot of nothing happening. Okay, it really starts at like the 9-minute mark, so I'm gonna go there and make sure my volume is up. Boy, there's a lot of them. So 1, 2, 3, 4, 5, 6, 7. Is that it? 1, 2, 3, 6. 6 doctors and 4 security. This is big. Oh no, there is 7. There's 7 doctors. Very interesting. I can tell you right away that in my facility, there'd be 1 doctor assigned to them.
Since we spoke last, the President has continued to improve. As with any illness, there are frequent ups and downs over the course, particularly when a patient is being so closely watched 24 hours a day.
Okay, so closely watched 24 hours a day makes me think ICU, so that maybe his condition is really, really bad and they're just not telling us he's in the ICU. I want to learn more.
We review and debate every finding, compared to existing science and literature, weighing the risks and benefits of every intervention, its timing, as well as any potential impacts a delay may have.
Did he say they were debating every sign and symptom? I have never seen doctors debate signs and symptoms. I guess maybe they do that in their back room, but I'm really curious now to know what's going on.
Over the course of his illness, the President has experienced 2 episodes of transient drops in his oxygen saturation.
Okay, so 2 transient drops in his oxygenation means that these were just really a short period of time. They didn't last very long. So let's see what they say about those.
We debated the reasons for this and whether we'd even intervene.
Again, debating the reasons for this. What else is he there for? He's there for COVID. I think you know the reason, unless there's something else going on with this president.
It was a determination of the team, based predominantly on the timeline from the initial diagnosis, that we initiate dexamethasone.
Dexamethasone. Now, I did read that he had received a treatment prior to his diagnosis being shared publicly. And so dexamethasone is a steroid. It's often used to reduce inflammation. So I'm wondering if his respiratory system was really struggling.
I'd like to take this opportunity now, given some speculation over the course of the illness, the last couple of days, update you on the course of his own illness. Thursday night into Friday morning when I left the bedside, the President was doing well, with only mild symptoms, and his oxygen was in the high 90s. Late Friday morning when I returned to the bedside, the President had a high fever, and his oxygen saturation was transiently dipping below 94%.
94. Like, I'm not even excited about below 94%. Like, if I'm still ordering my lunch to be delivered, I'm going to finish my skip the dishes order before I even walk down to that room with a report that his stats are below 94%. That is so vague. I want to know exactly what his stats were, exactly what his temperature was, and what else was going on. And I'll just share. You would never see a nurse chart they are doing well, because that means nada. I actually want concrete data. Let's see if we get some more.
Given these 2 developments, I was concerned for possible rapid progression of the illness. I recommended the President we try some supplemental oxygen, see how he'd respond.
I like his face there. His face tells me a lot there. I recommended it. I'm not sure if he thought it was needed with a SAT of 94 or below 94%, or if, and he recommended it, he knew that the president was going to decline it because it sounds like he wasn't that sick. Let's listen some more.
He was fairly adamant that he didn't need it. He was not short of breath. He was tired, had the fever, and that was about it. And after about a minute.
So at this point, I'm thinking this guy should be at home. Like if it was anybody other than the president. I get it, it's the president. The president needs to be protected because he is in fact running the country and he is serving his population. So, despite my own personal feelings and thoughts about the president of the United States, Donald Trump, I'm right now wondering if he was well, he wasn't short of breath, he simply felt run down and had a fever. First of all, why is he in the hospital? One. And two, why are there 7 doctors coming out? Like, are they all treating him? 7? Right now, this sounds like something you could hand off to a resident.
Only 2 liters. His saturation levels were back over 95%. Stayed on that for about an hour, maybe, and it was off and gone. Later that day, by the time the team here was at the bedside, the president had been up out of bed, moving about the residence with only mild symptoms. Despite this,
later that day when the team was around the bedside, so they didn't rush to his bedside. The team didn't feel the need to drop what they were doing to run to the bedside. That's very interesting and that's very telling. So this is letting me believe that he's just got a mild case of COVID and would typically be somebody we would send home and provide symptomatic care for. So if you have a fever, drink lots of fluids, take some antipyretics such as a Tylenol or acetaminophen, depending on what you call it. And rest. Don't exert yourself. Interesting indeed. Let's watch some more.
everyone agreed the best course of action was to move to Walter Reed for more thorough evaluation and monitoring. Now I'd like to invite up Dr. Dooley to discuss current plan.
Really? So you're either not telling us something because if someone has a fever and feeling run down and you've already given dexamethasone, okay, so that's like a red flag in the back of my mind as well. Dexamethasone, you don't just give that for a fever and you don't just rush people. Oh, actually, let's take the word rush back because he didn't rush there. And if that was the decision that he needed to go, he must have been a little bit more sick that their own medical team could not handle the fever and that transient dip in oxygen. Don't you think? Nurses, what do you think? Comment below and let me know your thoughts on this. This multi-doctor, multidisciplinary approach to dealing with somebody who is currently being presented to only have a fever and a short dip in oxygen. Let me know below, comments.
Before I begin a brief clinical update on the president's condition, I do want to reiterate my comments from yesterday regarding how proud I am to be a part of this multidisciplinary, multi-institutional team of clinical professionals behind me, and what an honor it is to care for the president here at Walter Reed National Military Medical Center.
Yeah, despite what you think, it is an honor to be part of a medical team caring for dignitaries and to be in such a highly publicized case. When I was in Afghanistan, I completely felt honored to care for every single soldier that I cared for in the emerge and in the intensive care unit. And even when I returned to Canada, I actually was assigned to be a private nurse for a patient in a hospital in Winnipeg. And I would go there, work 12 hours every day during the day shift. I was his primary nurse. He was my only patient. It was such an honor to care for these people. So I totally respect that.
Regarding his clinical status, the patient continues to improve. He has remained without fever since Friday morning.
No fever?
His vital signs are stable. From a pulmonary standpoint, he remains on room air this morning and is not complaining of shortness of breath or other significant respiratory symptoms. He is ambulating himself, walking around the White House Medical Unit without limitation or disability. Our continued monitoring of his cardiac, liver, and kidney function demonstrates continued normal findings or improving findings.
So that's all great news. It sounds like a typical patient who just needed some supportive care, has received that, and is ready to go home. No shortness of breath. He's ambulating. They don't talk about walking or talking in full sentences, which would help me to know if he's able to be active without becoming short of breath. But I could probably assume that based on this, his respiratory function is intact.
So, and I'll now turn it over to Dr. Garibaldi from Johns Hopkins to talk about our therapeutics and, again, our plan for the day.
Oh my God, another doctor? Wow.
Thank you, Dr. Julian. I just wanted to, again, reiterate what an honor and a privilege it is to take care of the president, but to be part of such a talented and multidisciplinary team here at Walter Reed. The president yesterday evening completed his second dose of Remdesivir.
Remdesivir. I gotta look that one up.
So the U.S. Food and Drug Administration has issued an emergency use authorized to permit the emergency use of an unapproved product for those suspected or confirmed with coronavirus 19 in a hospitalized patient. This may be, in fact, the reason why Donald Trump was sent to the hospital, because in order to get this drug, he needs to be hospitalized. I'm going to put the link of this down below for you, but I just wanted to go down to the authorization. So watch, the screen's going to get a little crazy on you here, because there are some very specific instructions for healthcare providers that need to be met in order to provide this medication. Here we go. Mandatory requirements for remdesivir administration under emergency use authorization. All of the following requirements must be met. So the first is that treatment has to be of a suspected or confirmed coronavirus diagnosis in a hospitalized adult pediatric patient, specifically for those whom the IV agent is clinically appropriate for. Number two, the healthcare provider must communicate all the information available so that the patient can essentially make informed consent. Number three, they need to look at the kidney function to make sure that they can actually excrete this drug. Number four, liver function tests are done. So that's why we're looking at his kidneys and liver. That's pretty typical with medications. Want to make sure they don't have a hypersensitivity reaction, previous exposure, and that the prescribing healthcare team is responsible for any requests from the FDA for information, and then will of course report any medication errors and adverse events. Aside from that, there's really nothing too exciting in here about that.
He's tolerated that infusion well. We've been monitoring for any potential side effects, and he has had none that we can tell. His liver and kidney function have remained normal, and we continue to plan to use a 5-day course of remdesivir. In response to transient low oxygen levels, as Dr. Conley has discussed, we did initiate dexamethasone therapy, and he received his first dose of that yesterday, and our plan is to continue that for the time being. Today he feels well. He's been up and around. Our plan for today is to have him to eat and drink, be up out of bed as much as possible, to be mobile. And if he continues to look and feel as well as he does today, our hope is that we can plan for a discharge as early as tomorrow to the White House, where he can continue his treatment course.
Yes, discharge. It doesn't even sound like it should have been an admission based on their symptoms, but they are providing some medical benefits. So liver and kidney is fine, heart and lungs are fine. The president is up mobile, he's walking. We want him to eat and drink. That's the natural progression when people start to feel better, is we start to return to them some of those normal functions that were taken away while we were trying to figure out just what was going on. So the fact that he's able to eat and drink, we're going to mobilize him, super important, especially when we're dealing with lung injury and illnesses, because the longer you stay immobile and you stay lying down, the more secretions build up in the lungs, the harder it is to remove them. And then, of course, your oxygen again will decrease. Infection can start to set in. Not a good picture. So if you've ever been a patient, and maybe you have, comment below, let me know if this has happened to you. Those pesky nurses come into your room and they try to get you up for breakfast, up for lunch, up for supper, yes, up for supper, walking down the hallways, physio gets you moving. It's all about returning you back to normal. And I know patients sometimes do not like it. And my students have struggled in the past to collaborate with their patients to get them up for breakfast, but sometimes they just want to stay in bed, and it takes a lot of finesse to get those difficult patients. Actually, let me correct that. I never like to say difficult patients. It takes a lot of finesse to get patients to find that it's in their best interest to get up for meals and to walk around. Let's finish watching this. I think we're almost done.
Thank you very much, and I'll turn it over to Dr. Connolly for any questions.
All right. Dr. Connolly's coming back up.
Just a moment, please. President wanted me to share how proud he is of the group, what an honor it is for him to be receiving his care here at Walter Reed, surrounded by such incredible talent, academic leaders, department chairs, internationally renowned researchers and clinicians, including the support of Dr. Garibaldi from Johns Hopkins. I'd like to reiterate how pleased we all are with the president's recovery.
Well, that was lovely. Even if it is the president and it comes across as maybe a presidential thing, it's always nice to be appreciated by your patients. First and foremost, the fact that they recognize what you're doing for them and that you're working hard and that there is a team behind them really focused on getting them back to their quality of life. It is always nice for appreciation. So that I will give kudos to. Now it's the media scrum.
Second one, and also I got a question for the lung specialist afterwards.
Sure. Yeah. Yesterday there was another episode where he dropped down about 93%. He doesn't ever feel short of breath. We watched it, and it returned back up. As I said, we evaluate all of these, and given the timeline where he is in the course of illness, we are trying to maximize everything that we could do for him, and we debated whether we'd even start it, the dexamethasone, and we decided that in this case, the potential benefits early on the course probably outweighed any risks at this time.
Did you give him a second round of supplemental oxygen yesterday?
I'd have to check with the nursing staff. I don't think that if he did, it was very, very limited, but he's not on oxygen. And the only oxygen that I ordered or that we provided was that Friday morning initially.
What time was that yesterday?
Yesterday, what was yesterday?
You said the second instance.
Second incidence? Oh, it was over the course of the day, yeah. Yesterday morning.
So dexamethasone is a steroid, as I mentioned earlier. It's used in a lot of different conditions, but of particular note for this video, it's talking about respiratory conditions. But the side effects that they're talking about, because it's a steroid, it can cause fluid retention. Now, I don't know his cardiac status. They did say that it was fine. His kidney status was fine. So based on that, I wouldn't be concerned about the fluid status. But if you got somebody who has heart failure or kidney failure, increasing fluid status is a balancing act for sure. It also can cause high blood pressure. Now he is, I don't even know how old he is, but he's in that bracket where he would be at higher risk for high blood pressure. He has a high stress job. I don't know how well he eats or exercises. So those are kind of things that we would be looking for. That they debated about whether they would start it makes me think he was probably a borderline patient, and it may have been really early in his COVID journey. So Thursday, Friday, Saturday, Sunday. We're at day 4 and they started that already. We know that he is in that window where the symptoms are going to start to escalate and become the worse that they are. So that first 3 to 5 days is your prodromal, your pre-awareness state when you have the infection but you don't know about it, and then you start to show signs, which sounds like that was Thursday. So he's just in that window where things get worse and then they should get better. Oh, and let's just talk about that 93%. Really? I don't know what y'all do for parameters. Y'all, I'm bringing out my southern accent for this part, and I don't know why I did that. But 92 and above is considered normal. 100% is the max you can get. If you start to go lower than 92, we start to look for causes. If you get into the 80s, we're getting a little bit more concerned. With that, I should share that there are some caveats. Like if you have COPD, you don't want to be at 99%. You actually want to be lower because the drive to breathe is a little different for those who have COPD. But that's not the case here with the president. So a 93, again, I'm not running down to that room for an O2 of 93. That being said, we never treat the number. We always treat the patient. So if he was short of breath, having difficulty breathing, difficulty being able to finish his sentences, not able to sit up because he was too fatigued, then we would likely put the oxygen on to see if we could recover the body to the point where he could participate again.
Dr. Conley, what is the president's current blood oxygen level? That's my first question to you, Dr. Conley.
98%.
And what
He's so proud of that 98%.
What do the X-rays and CT scans show? Are there signs of pneumonia? Are there signs of lung involvement? Were any damage to the lungs?
Yeah, so we're tracking all of that. There's some expected findings.
They're tracking the respiratory system for signs of pneumonia, for signs of infection, etc. And the doctor was not very clear there. He just says we're tracking all that and there are some expected findings based on COVID. So now I'm thinking that this is a little bit more serious, and that is why they decided to start the dexamethasone.
No, it was below 94%. It wasn't down into the low 80s or anything. No.
Okay. So the dexamethasone, the steroids, sir. Yesterday, you told us that the president was in great shape, had been in good shape and fever-free for the previous 24 hours. Minutes after your press conference, White House Chief of Staff Mark Meadows told reporters that the president's vitals were very concerning over the past 24 hours. Simple question for the American people. Whose statements about the president's health should we believe?
So the chief and I work side by side, and I think his statement was misconstrued. What he meant was that 24 hours ago, when he and I were checking on the president, that there was that momentary episode of the high fever and that temporary drop in the saturation, which prompted us to act expediently to move him up here. Fortunately, that was really a very transient, limited episode. A couple hours later, he was back up, mild again. I'm not going to speculate what that limited episode was about so early in the course, but he's doing well.
What are the expected findings on his lungs, and why is the president not wearing a mask in the videos and photos that have been released?
Well, the president wears a mask anytime he's around us, and we're all wearing our N95s, full PPE. He's the patient, and when we can, when he'll move out into to public, we move him out and around other people that aren't in full PPE. I assure you, he'll as long as he's still under my care, we'll talk about him wearing a mask.
A negative pressure room.
I like that. He didn't say the patient's going to wear a mask while he's under his care. He said, as long as he's under my care, we're going to talk about him wearing a mask. So it sounds like there's some education happening. It does sound like he is wearing it. But there's not maybe 100% compliance there.
The room is negative pressure.
I'm not going to get into the specifics of his care.
You're not going to get into the specifics of his care. You've just talked to us about dexamethasone, remdesivir, oxygen, mobilization, but you can't tell us if he's in a reverse isolation room? Come on.
I'm sorry?
The lung function question. Can you talk about that? And what do you expect?
I would just share that, like every patient, we perform lung spirometry on him, and he's maxing it out. We told him, see what you can do, and it's over 2,500 milliliters each time. He's doing great. Yeah.
Showing any irregularities in his lungs? Are there any
until today to disclose that the president had been administered oxygen?
It's a good question.
Thank you.
I was trying to reflect the upbeat attitude that the team, the president, his course of illness has had. Didn't want to give any information that might steer the course of illness in another direction. And in doing so, it came off that we were trying to hide something, which wasn't necessarily true. So here I have it. He is the fact of the matter is that he's doing really well. That he is responding, and as the team said, if everything continues to go well, we're going to start discharge planning back to the White House. That's it. Thank you, folks.
That's it. That's the end of that press conference. So overall, not a lot of information provided. The stuff that they did provide didn't sound alarming to me as a nurse. I think he's very lucky to have the team that he has, considering the symptoms they present. So we'll have to keep an eye on this and watch it as we go forward. Listen, at the end of the day, COVID virus is a serious virus. It has definitely claimed lives. We have learned a lot about comorbidities that make you more susceptible to having a higher response to it, a more acute response to it, requiring medical care. So Obviously, this is a case of interest because it is the president, and we're going to be looking and watching this over the next little while to see what happens with him and how he talks about it specifically afterwards. Until next time, guys, make it a great day. Hey, I know you're probably not ready to get off your phone or go back to work just yet, or maybe even turn the lights off to go to sleep. So why don't you spend a little bit more time here watching another video.